Hello everyone, this is Dr. Jones from DrBeen.com. Today in the psychiatry series, we're going to be talking about obsessive-compulsive disorder. In this lecture, we'll talk about the presentation, diagnosis, and treatment approaches to obsessive-compulsive disorder. So double-checking things can be pretty common behaviour. For example, did I lock the front door? Or did I leave a light on? But what happens when this becomes excessive? Where you feel compelled to check that you've locked the door perhaps multiple times, maybe 20, 30, 40. At this point it becomes an obsession. And what if you have to do a certain ritual with your bedroom lights before going to sleep? For example, maybe you have to turn the light on and off 20 times, and then you have to close and open the door 5 times before you can go to sleep. Then this is known as a compulsion. Obsessive-compulsive disorder is characterized by obsessions and/or compulsions that lead to significant distress and dysfunction in social and/or personal areas. A typical history may be the following. So, obsessive-compulsive disorder presents in late adolescence or early adulthood. Many OCD patients may present to a non-psychiatric specialty initially, such as dermatology. Maybe they're overwashing their hands. It could be a skin complaint. Obsessive-compulsive disorder affects around 3% of the population. Prevalence is equal in male and female patients and is often chronic and difficult to treat. The main characteristics of OCD are the obsessions and compulsions. Obsessions are anxiety-provoking intrusive thoughts that commonly concern doubt, guilt, contamination, aggression, and sex. Some examples could be, have I locked the front door? Are there germs nearby? Or will something bad happen if I don't do a certain action? Compulsions, on the other hand, are peculiar behaviours that reduce anxiety. They could commonly be organising, hand washing, checking, counting, and praying. And there's a few others. This is some examples. So some more examples could be, you could be checking if the door is locked. So that's the compulsion linked to the obsession, which could be thinking, have I locked the front door? Another compulsion could be washing your hands multiple times. And this could be paired with the obsession of germs, for example, like are there germs present? And lastly, another compulsion could be repeatedly turning off a light switch. And your obsession could be, if I don't turn on and off the light switch for an exact amount of time, so maybe 20 times on and off, that I could fail an exam. So patients, this is a really important point, patients recognise that these behaviours are excessive and irrational and wish they could get rid of the obsessions and compulsions. So let's have a quick look at DSM5 criteria. So DSM5 criteria states that for a diagnosis of obsessive-compulsive disorder, a patient needs to have obsessions, compulsions, or both. They need to engage in time-consuming activities which impact on daily life. So, for example, what we were talking about earlier about turning the light on and off before you get to bed. That's obviously going to waste some time. Thirdly, this cannot be due to another medical condition or substance abuse. And lastly, it's not better explained by another disorder. So what causes obsessive-compulsive disorder? Well, it's thought that abnormalities in the serotonin metabolism are to blame. However, there is also a genetic component. So, in terms of treatment, how do we treat obsessive-compulsive disorder? Well, psychotherapy is a good first-line therapy to go with. So cognitive behaviour therapy, for example, the main one is exposure and response therapy. It's been shown to be highly effective, where you try to change the patient's behaviour patterns. So if they feel like they have to turn the light on and off, otherwise won't be able to get sleep or fail an exam, then you expose them to not turn the light on and off, and you get them to realise that nothing bad is going to happen. And that therapy has been shown to be quite effective. In terms of medication, the first line pharmacological intervention is always selective serotonin reuptake inhibitor. So for example, sertraline. And this can be quite effective, and it kind of tackles that serotonin metabolism abnormality.
Guys, thank you very much for watching. Make sure that you like this video if you like it. If you don't like it, then do unlike. Like this video, subscribe to the channel, and please share this channel with others as well.